Hi guys, in this video I'm going to talk about this subject which is called as Dental Anatomy and Histology. This subject is what you will face in first year dentistry, and you're going to think of this subject as kyun pad rahe hai? Why the hell are we studying it? So yes, let me break it down for you as to what I think about this subject after my dental degree. So I feel yes, you should take this subject a little seriously, but I do think that there is a way to do it. In college, you're going to learn dental carving. Okay, so this is the practical part of dental anatomy where you're going to take a wax block and you will be asked to make a tooth out of it. It was, like very fancy when we entered and we were told to do this. In fact, I very clearly remember that my teacher asked me to take the wax block and do whatever you want with it. And I was not even able to make a decent flower out of it. So the first day of dental college, I was like, where am I? Why am I asked to do something like this? But eventually, yes, once you get the right method of how to do it, I was decent at doing dental carving. But I thought, why didn't somebody tell me why I should be doing dental carving? The reason that I look at after 5 years is that you need this motor skill, right? That comes by practicing a lot of carving when you want to do a treatment on a patient. There are various treatment options on a patient where you need to understand how the tooth exactly looks like, right? And for that, you need to have your skills which you learn in first year to be able to make a great looking tooth, right? Because you're not having a tooth, you're trying to build a tooth. So you'll have to make it like how the original tooth looks like. So that's one place where you will really thank yourself that we did dental carving in first year, and that's going to help you and take you a long way. But apart from that, the way I feel you should approach this subject is first understand the anatomy of the tooth, okay? And then you move on to carving. What we as students usually did is we divided. Ye to theory hai, ye to practical hai. But aise nahi hona chahiye. You have to look at the practical, you have to understand the theory while doing the practical and then correlate it. That's the only way you will grasp this subject really well. This subject also has another counterpart, which is dental histology, which everybody would find difficult. But I would say that if you really open standard textbooks and try to really, dig into it, really try to understand, you will probably start liking this subject, and eventually it's going to help you because in third year you have a massive subject called oral pathology, and these two subjects are really related. So if you given that time right now, you might not struggle in third year. So that's the only incentive I feel you have for dental histology. Now, apart from that, this particular skill of carving really builds precision and attention to detail. Like, as a person, I was very messed up. But because, I had to sit for hours and carve a tooth and make it look like a perfect tooth, because otherwise the teacher is just going to throw it. It really builds that patience and that precision that, okay, this is how I need to sort of carve a tooth. So and eventually once you do hundreds of carvings, you will find a change in yourself that, yeah, you've become a little more patient in order to get that skill right. So yeah, this is what I thought. These are my takes on this subject called Dental Anatomy and Histology. If you have anything else that you figured out for yourself, please write it down in the comment section and I'll be there to answer it. Thank you so much.
Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.